Hi, I'm Mike. I was diagnosed with type 2 diabetes, a chronic disease as we know. Since then, it has become increasingly difficult to keep the glucose levels in my blood stable, in spite of my medications. However, without effective control, diabetes can have severe long-term consequences, like eye disease, kidney impairment, and nerve damage. Even an increased likelihood of heart disease and stroke, just to name some of the most important complications. I immediately changed my diet and exercise habits and was started on oral anti-diabetic therapy with metformin. But that didn't bring down my high glucose levels sufficiently. My doctor intensified my therapy, successively adding a range of different traditional oral medications like sulfonylureas, alpha-glucosidase inhibitors, and TZDs. With my busy life, this was often a challenge, as some needed to be taken multiple times a day. Others upset my stomach. I needed to visit my doctor often to have the dose adjusted, and switching to injections was out of the question for me. As if this were not enough, some of the medications made me gain weight. I don't want to remember that one event where, without any warning, I suddenly fell unconscious when my blood sugar went too low, a hypoglycemic episode. And I know my doctor is doing his best to find the right treatment for me. My doctor told me that the modern approach to managing diabetes is to not only normalize blood glucose levels, but more importantly, to keep them as close to normal as possible while avoiding harmful effects to the body. How? Well, my friend here can explain that a bit better. Professor? Professor, are you there?
Oh. Hello, Mike. Here I am. Now you just sit back while I take over from here. DPP-4 inhibitors are a newer class of oral anti-diabetics, which have important advantages over the traditional treatments. Why? Well, here's what happens in Mike's body. When the tablet enters the stomach, the process begins. The DPP-4 inhibitor is rapidly absorbed into the bloodstream. In the gut, two incretin hormones, GLP-1 and GIP, are secreted in a glucose-dependent manner. The DPP-4 enzyme rapidly breaks down the naturally occurring incretin hormones, like GLP-1 shown here. But when the DPP-4 inhibitor binds at the active site of the enzyme, DPP-4 activity is stopped. Incretins are not broken down, so naturally occurring levels are prolonged, and they can contribute to their role in keeping blood glucose levels stable. So, in summary, DPP-4 inhibitors improve glucose control. By inhibiting incretin breakdown, they stimulate the right amount of insulin secretion at the right time and suppress glucagon's release, thereby reducing glucose release by the liver. That explains how they work, but you will also want to know why they are effective and safe for patients like you. Importantly, as the majority of DPP-4 enzyme is effectively and continuously inhibited, blood glucose levels not only decrease, but are kept stable during long-term treatment. Mike, in your case, we need to be especially careful about what you take because of the kidney problem we detected last time you were screened. Some of the anti-diabetic drugs are either no longer suitable or have to be dose adjusted based on additional monitoring of your kidney function.
I have high expectations of this newer class of drugs called,
Dipeptidyl peptidase 4, or for short, DPP-4 inhibitors.
Oh, thanks. Well, it sounds very promising. Something effective, tolerable, easy to take, with many long-term benefits. I look forward to future advances in this field. I'll keep you posted. Until then, goodbye, and I wish you the best of health.